Caitlin and I are laughing as we start this episode because we can never remember what episode it is, even though it's literally in the title. I can see it there as episode 5. And I was like, Caitlin, what episode is this? She's staring at me. So, welcome everyone to episode 5. We are going to be continuing our psychotropics podcasts, kind of hit or miss sporadically, so to speak, as we develop content for those. Today, we're actually going to be talking about medication carts and some of the things that we see, why audits are so important. But before we get into that, I don't know about you, Caitlin, but life is just crazy. There's so many things that happen at home with the kids. I was telling Caitlin, y'all, that my daughter is a note writer. She loves writing notes. And I think it's really sweet that she likes to write people notes, but it's getting excessive. Now, every time she gets in trouble, she has this like little heart pad. She's got several of these little notepads, little sticky notes, and she'll write how she's feeling on them when she's getting in trouble. And so now I'll be like, okay, Everly, go and do this, this, and this. And I'll hear the whining and the huffing and puffing about it. And then all of a sudden she comes trotting up with a note and like slaps it on my chest. And I'd pull off the sticky note and it'll be like, Dad, I'm upset because you told me to clean my room. I'm just like, you can use your words. I'm literally right here.
Yeah.
But it's hilarious. I mean, some of them are really good. She'll put Bible verses and or her version of a Bible verse on there which are really kind of fun to read. We just read a book together the other day, and I was reading it, or she actually read it. I think she had pulled it out of our playroom and where all the books are at. Anyways, she read this thing. It was called "Even Superheroes Have Bad Days," and I was grumpy about something at home. I mean, I'm only human, right? And all of a sudden, she comes around the corner and slaps one of those little heart sticky notes on the counter. And I read it, and it's like, "Don't worry, Dad. Even superheroes have bad days." And I just busted out laughing. I'm like, okay, she's got a good sense of humor too. That's what's been going on in my life is the crazy world of trying to parent children, which is,
Mhm.
if only they knew how much we all just fly by the seat of our pants.
All the time.
What's been going on with you, Caitlin? Anything fun? I know you're building a house and all sorts of things.
Yeah. So me and my husband are crazy, and we are the contractors with zero experience. But my dad, thank the good Lord, has experience. So he's basically navigating the project in the meantime, cursing me for making changes because, I'm a girl. I
Yeah.
want certain windows, I want
Day
certain
of. I
doors,
want to
and,
change.
all that good stuff. And so the newest development recently is that the house, when they poured the foundation, now they poured it bigger, so it's bigger. I was ecstatic, but apparently that's not good news.
Yeah, that kind of throws some plans off, come to find out.
So, yeah. Yeah, so my father, he's funny. He's just a funny, grumpy old man. That's all I got to say. But it's been fun. I mean, it's kind of cool, overseeing that and
Yeah.
learning about how they build and the skill sets that come with all those different jobs. So it's been a lot of fun,
Yeah.
uh, and a
So if
lot of
anybody
funny
has
funny stuff.
house problems, Caitlin will be your girl. That'll be your side gig, fixing
Yeah, I'll
people's stuff.
text dad.
Yeah. Thanks. Text Dad. He'll figure it out.
I'll text dad. Yeah, just let me know. I got a direct contact right to him.
Love it. Love it. I may hit you up on that for sure.
Yeah. Mhm.
Okay, well, we know that it's crazy for everyone, and we wanted to take just a little bit and talk about medication carts because that's in our wheelhouse and we see them all the time and audit them all the time. We get a lot of questions, I think, especially from newer nurses or med aides that are passing of like, why are we looking at the carts? What exactly are we looking for? I
Mm.
think the why is pretty obvious, and Caitlin backed me up on this, but the why is that that's where you're passing meds from. So we want to make sure that it's accurate. We want to make sure that there's no expired meds. We want to make sure that they're stored correctly. All those kind of that security is handled correctly for controlled substances and all those things. And the only way that we can do that is to get our hands on the cart and to take a look at it. Sometimes it's even fun to fix the carts when they break. So I've been doing that. And it's always fun to watch people be like, it's like a their mind is blown that some nerdy pharmacist is in there and he's like tinkering with their track on their top drawer and gets it fixed, and
Yeah.
they're like, "Oh, it's working perfect." But
Oh, my dad was super excited about that bag that we
oh
got with all the
yeah,
tools. He
yeah,
was like,
the
"Are you fixing stuff?" Like,
yeah.
there was severe concern on his face,
He's like, "Wait a second here,
but then
Scott's in
sidetracked,
that."
he was like, "Are you using that bag? Because that's a nice bag." And then he wanted the bag.
Got another one over here in the corner of the office, but yeah, and all of our consultants, maybe I shouldn't disclose this, but all of our consultants are armed with tools and extra parts
Mhm.
and stuff for the carts, and because you just never know. I mean, I've rigged carts up that we were waiting on a part before, and I like to tinker with stuff. Y'all probably don't know that about me, but I like to tinker with stuff. Not that I'm great at it by any stretch of it, but I've gotten better through the years. But things like I'll pull out a drawer and I'll look at how it's constructed and go, oh well, this is spring is broken here. So, if I pull this around here and duct tape it up, we can make it work until the part comes. And we've done that before. So sometimes fun to do even that kind of stuff with the carts. But that's the why. I mean, obviously we want the residents, and we know that y'all listening in want the residents to get the right meds at the right time, all the things that you see with MedPass, but it all starts kind of with the cart and making sure that everything is there. So we wanted to take this is maybe not a long podcast at all, which I think could be pretty fine because I mean it doesn't have to be long to explain med carts and audits and all that kind of stuff. But we wanted to take just a little bit and Caitlin and I explain some of the main problems that we see and have seen over the years with medication carts. So, Caitlin, take it away. Tell us some of
Yeah.
the problems that you see.
So, even at the best facilities, it's difficult to have everything dated and keeping up when those things expire and reordering before that. And I think there's a lot of different reasons as to the why behind that. Obviously, their time management, they have a lot of things going on. There's a lot of different people that get on those carts. You know, day shift versus night shift versus overnight, and they all have different flows. And sometimes, one nurse likes it a certain way and then the other one moves things around. And had it have been in the place where it was, that morning or where they're used to seeing it, it would have prompted them to put a date on it or know to reorder it. So it's just very easy for some of those things to kind of fall through the cracks. But that, even at the best, well staffed and consistent, workers or employees, they have a hard time getting every single little thing dated and then also keeping up with the expiration of when to reorder. And you would think that the day supply would kind of take care of that, but it doesn't with everything.
Mm,
Some eye drops come well over 30-day supplies. Uh, and then, also some expiration dates are 6 weeks or they're 90 days are not always on that 30-day rotation. And then you have patients who go in and out of the hospital and they come back. And so you have gaps of, med pass and getting those treatments in that time frame. So that's probably the biggest thing that I see is that dating and then pulling it when it's being, it coming up expiring.
yeah, I we see that a lot on the
Mhm.
dating. I think it's kind of human nature. I can imagine if every time you were pulling a certain thing out, but it's not everything you're pulling out, you're dating just that thing. I think it
Right.
is really easy to forget to date insulins and eye drops, and but it's so important because those do have, like Caitlin was mentioning, shortened expiration dates, and they do vary. And so not knowing when that is opened or has been opened or taken out of the fridge is really hard then to determine when it's going to expire. And so if you're a new nurse or a new med aid, that's why we see the open dates on there because we really need to know when to pull those insulins or expired meds off. Loose tablets, we see,
Yeah.
depending on how full the cart is, I mean, you can get 20, 30 residents on a med cart, depending on how how many meds they have. And we've kind of talked about that in some of the past episodes that we see a lot more meds than we used to. But they get kind of crammed in there, those cards, right? And or
Mhm.
the OTCs on the top shelf or something like that. They're going to pour one into one of the little med cups and one falls out and kind of just gets pushed into the back of the drawer. If they're in the cards themselves, they typically find a way out of the back foil, fall underneath. And as you're pulling and pushing one in there, they work their way to the back. And so you see them all in there. Obviously, we want to pull those loose tablets out, and our team does that. And it may seem like, okay, well, they're just cleaning it up. Well, it actually can prevent deficiencies by pulling those out because that could be a med storage tag, depending on how the state surveyor teams interpret that. And so we see those loose tablets. We mentioned, Kayla and I were talking about DC'd meds. We see that quite a bit too. We know that in long term care, med orders change routinely. And, disease state management can be difficult, complex, very patient specific. So we see the meds changing to meet their needs or new meds started and other ones DC'd. And that's an easy one to forget to do because again, they must pull those cards out, or you guys are pulling those cards out of the cart, taking them into destruction, logging them, all that kind of stuff. And it takes time. It takes time
Mhm.
to do that. So
Yeah.
we see those as well. We see overflow. We were talking about this too, that sometimes like on the bottom of the cart,
Mhm.
med rooms, all that, those areas, we see overflow. That can be a variety of reasons behind that. Caitlin mentioned the hospital stays and things like that can mess that up. Overflow where it's convenient, ordering in, getting those cards in, having them ready to be giving those meds. Those oftentimes, if they have PRNs and stuff mixed in the overflow, they expire. And overflow is often forgotten until a med is needed out of the overflow, right? And so we audit those things like crazy. What else, Caitlin? I'm trying to think of some other ones that we see.
Uh, Well, we touched on pulling off the DC meds, the overflow. My big thing with overflow too is, and even though the nurses during med pass is supposed to look at the MAR and not the
Hmm.
med cards, but you will catch that muscle memory. And if they're on those carts all day, every day, and this is a long-term resident that nothing ever changes, it'll be the time that it changes. That sometimes the active meds will be in the overflow because they couldn't fit it on the cart.
Right.
And so where they pull all their sets up of the, cards up, they'll forget to go down there and get those additional active ones because 'cause they're not following the MAR, they're following the stack of cards. So overflow, loose pills, expired meds, I mean, it all kind of leads and tapers into med errors. And when the cart's not concise and organized, you kinda see those things happen. And, like, I was at a facility last week, I was like, "Wow, this is a lot of artificial tears." Like, everybody was on artificial tears. And I was like, "Well, I wonder if, like, maybe we can ask some of those to get taken off." I go
Yeah.
home and lo and behold, there's only 4 people in the whole building, so it was all DC'd, but they were giving them. So it's also like you're giving meds that are not active anymore.
Yeah.
So that's kind of like the whole picture for me and how it all kind of feeds together into the main issue of how it contributes to those med errors and confusion. And
Yeah.
when you have, like we talked about before, the different nurses coming in on those cards, it's very difficult when you have 20 residents, you've never been there before, you're getting familiar with them. You don't know where the med room is. You don't know where the medical supplies may be in the med room or where the crash cart
Right.
is. Like all these things, you're trying to figure out where that is. And then you're getting, belled from the resident that they want to get up and they want to go to the bathroom. And when that cart's a mess and you're trying to pass meds and all of that, that's very difficult. So that contributes to med errors of it just not, even if everything is in there, that, it not being organized and being where it makes sense to somebody else coming into it to be able to find it.
Yeah.
So it's hard, and I know it's hard, and I sometimes when I'm approaching them with things that I find, that's the first thing I say is, "Look, I know this is not easy. You have a million things going on, and I am so terribly sorry, and I applaud all of your efforts. I know it's not easy, but these are the things I found, and I'll help you any way that I can." So it's just it's MedCarts is just one of those things that it's gonna be a constant education and us working together to try to figure out ways to make it better for the residents and for the nurses too.
Yeah, and I think that's kind of what we wanted to end on was talking about how we can work together as your consultant pharmacist, as you guys that are nurses and med aides with our directors of nursing, ADONs, or if you call them director of nursing service, DNSs, et cetera. I think one of the things that Caitlin and I want to say is that obviously we all want to work together. This is a common goal that we have. The idea of auditing from our end, at least from us at Farm Care, is not to point the finger and to say, look, you're doing something wrong. It's to educate, it's to encourage, it's to come beside your guys' teams and to kind of walk alongside you guys in that process of making sure that there's some systems in place and things that like Caitlin was mentioning, organization of the carts and that kind of thing. And you would I mean, it's not a shocker. I think I've been in facilities before. We had just taken them over as for pharmacy services, for consulting services, and I would go to the different carts, and, like, one cart, like Caitlin was saying, if it's disorganized, one cart, the OTCs were in, like, drawer 3, and then the other cart, they were in drawer 1, and so if that nurse is covering the other hall, now she's lost or he's lost, and so we can kind of provide some of that, like, second set of eyes that you guys need sometimes, and you can obviously then explain perhaps why that's the case or how we can work together. Long med pass times on a hall, there's tons of residents that you're passing to. Perhaps we can work on the time of administrations with you guys. So when we talk about partnering with y'all, I think the first step is that here at Farm Care, our consultant pharmacist, we audit your carts. So you have the same consultant pharmacist that's reviewing your facility is the one that's auditing your carts. So you have that kind of friendly face and the name that you're familiar with. Like Caitlin said, present those findings to you guys. During that discussion of, "Okay, well, here's what we found," we're also looking for potential system related issues. Maybe there's ordering that's not happening. Maybe there are just practices that could be sharpened on skills like dating, things like that. And so we're going to bring those to you guys. And I think how we partner in that way is that then there's systems on the facility side as well that you guys are doing audits and checking on your end when we're not there, so that it's kind of this like combination effort to try to make sure that we're kind of all ensuring the right medications, right? And so there's that side of it. Caitlin and I were talking about this, that we can obviously provide a lot of the things that would be an educational resource to you and your facilities. Things like shortened expiration date lists, we can provide that to you as a consultant pharmacist. We can provide education to your nursing staff, to your med aides. My goal has always been for the team is to not just say, here it is, and like dump it all on you guys, and there's no real explanation there. So I guess if that's happening, reach out to me. But the goal is never that. It was always to come alongside, like I was saying, and to explain why we pulled those things out and how then we can work together on that. And I always loved going into homes kind of back to back on those months and auditing the same cart, and the nurse maybe didn't date everything that previous month. They date it the next time I'm in there, and I'm praising him for it. I'm like, "Yes," "Now next thing that we can work on is this." And so really just this idea that we can educate, we can provide documentation, we can work with your team to understand the importance of this, work to establish systems, things like that, that we can, kind of in tag team work together on. So, Caitlin, anything else that I missed there?
Just no, but I'll throw this in here anyways.
She has to say no. She's like, "No, you're perfect. Didn't
I
miss a thing."
didn't miss a thing. And I think at Farm Care, we do a really good job at recognizing individual facilities for their own rhythms and maybe places that they are stronger and weaker in. I know
Yeah.
all of my facilities, I could tell you which hall's heavy, which hall's light, which hall, rotates a nurse, which hall has a consistent one. And then across the building where I see more of a area of improvement, whether it may be the insulin pens or it might be the inhalers, it might be DC meds, it might be everything, or it might just be 2 halls that are messy and or need help and additional education, and the rest of the building might be okay. So I think that that's really important too, and every consultant I've talked to, we all recognize that. No building's the same, and their areas of weakness and where we can come in and educate is gonna be different, and their flow is different, and what works for them is different based off their administrator, their nursing staff, their CNA, and just their entire management team. So I think that's really important too, that we recognize that and we're able to individualize our plans to what is really gonna provide them success for that building.
Yeah. Yeah, and I think that's one of the reasons why I mean, somebody out there might be saying, "Well, why use pharmacists to do that?" That was one of the main reasons. I knew the pharmacists had the relationships with the homes, and also we are just good with systems. I mean, that's just how it is. I mean, I think pharmacy school makes you good with, like, looking at system problems or systems in general, and, yeah, our consultants knowing that information about the home and being invested into the home was why I wanted them to audit. Sometimes they get mad at me about that because it is a lot of extra work on top of everything else they have, but I feel like, and I say this all the time, and Caitlin knows what I'm about to say, if we make a recommendation to change a medication that's gonna better a disease state, but we don't know even if that med is being passed, then we aren't looking at the full system picture. And I think when you remove that out and use auxiliary staff or something else to do your auditing, you remove that portion of good quality service as well as looking to see what you guys have. So we here to help in any way that we can. That's what we always want our customers to know. If you're not one of our customers and you're listening in, hey, there's still time to join up. So we'd love to
Give us a
provide
call.
give us a call. We'd love to provide services to your facility, both pharmacy and
Mhm.
which we don't even talk about how amazing our pharmacies are, but both pharmacies and consulting. And, I guess leaving y'all on this note that this is a partnership and we hope that this is maybe um, reignited some of the things that you already knew in your mind of things that you want to work on and you want to make sure that they're not forgotten. And perhaps it's given you some insight if you're newer into this field of things that you should look for and maybe things that you might not have thought about. And so that's what we want to leave you with is that we're here, we're your partners in all of this. And we want to help you guys make sure that you're passing medications in the most accurate and best way possible from a clean and organized and very well done med cart. So that's all we've got for this episode,
Yeah.
right, Caitlin?
Yeah, that's all
Super
I got.
short, 25 minutes. It still didn't seem that still doesn't seem very short, but it's shorter than our normal ones. But with that, we'll sign off and we hope that you guys have a blessed rest of your day.